Identifying patients who are at an increased risk of cancer due to their family history is the first step in determining whether hereditary cancer genetic testing is appropriate for them. There are 7 circumstances that can immediately indicate that a patient is at a higher risk of having a hereditary cancer syndrome. 1. If the patient has had any first-degree relatives with breast or ovarian cancer. 2. If the patient has had any relatives with bilateral breast cancer. 3. If the patient has had any male relatives with breast cancer. 4. If the patient has had any female relatives with both breast and ovarian cancer. 5. If the patient has had any female relatives with breast cancer diagnosed before age 50. 6. If the patient has had 2 or more relatives with breast and/or ovarian cancer. 7. If the patient has had 2 or more relatives with breast and/or bowel cancer. Based on NCCN and ACOG criteria, if a patient answers yes to 1 or more of these situations, an additional evaluation into the family history and possible hereditary cancer genetic testing may be warranted.